Welcome and good evening to this American College of Surgeons webinar presented by the Practice Protection Committee on Economic Survival Strategies. I'm Patrick Bailey, Medical Director for Advocacy in the Washington office of the American College of Surgeons. Before starting our program tonight, I would like to turn to our Executive Director, Dr. David Hoyt, for some opening remarks. Dr. Hoyt.
Well, thanks, Patrick, and good evening, everybody. Hope everybody's doing well. During the COVID crisis, the Regents and a group of interested physician experts really helped us think through strategies to have you all protect yourselves financially. And tonight is the third of those seminars to go over things that are important to you so that you can be thoughtful about your own fiscal situation and protect yourself and your family, et cetera. And we've got great advice tonight from people that have very pragmatic experience. And so I just want to extend my thanks to the Practice Protection Committee, Dr. Bailey for leading that, and all of our speakers tonight. And thank you all for all you're doing with your patients. Thanks, Patrick.
Thank you, Dr. Hoyt. Joining us tonight, as Dr. Hoyt said, are members of the ACS Practice Protection Committee who have prepared this webinar as a supplement to their recently released document on this topic. That document, along with the committee's financial resources document and two ACS primers for both private practice and employed surgeons, are attached in the handout section of this webinar for your convenience. Tonight, you're going to be hearing from four members of the committee: Mark Ader, Mark Savarese, Charlie Mabry, and Julie Conyers. To begin our program, we now turn to Mark Ader to discuss the Excel spreadsheet exercise, which is integral to the overall concepts presented in the Economic Survival Strategies document. Mark?
Thank you, Patrick. Well, Abraham Lincoln in his 1958 House Divided speech said, "If we can know where we are and whether we are trending, we can better judge what to do and how to do it." And that's really the point of the spreadsheets that was attached with this document, is to let you have an idea of where you are. If you were going to be talking about finances, both personal and business, you have to know exactly where you are, where you've been, what you're currently doing before you can make any decisions. So the information you have is going to be very powerful. It's going to be very crucial. And none of us makes a critical decision in surgery, in life, without good information and really accurate data. And that's what the sheets are. They're going to be templates for your data. Now, it's just written in Excel. Download it. They're yours. Just do whatever you want. Modify them, personalize them. We're going to look at a few things in a moment, but you need to have the numbers and the most accurate numbers you can get in order to make the real rational decisions on how to proceed. So there are some keys. This is going to take time. You're going to have to allocate some time. It's not going to be a quick 1 hour exercise. So you have to get it right. Collect all your documentation. And I'll tell you, the things to start off with are your bank statements, your credit card statements, and those two will probably give you the majority of what you're going to need for these spreadsheets. And take all your credit card. If you're like most of us, you have someplace between 5 and 15 different credit card accounts. And if you don't have that available, let me just tell you, go online to your banking site, to your credit card site. You can download those, you can view them, you'll be able to get the information. Now, the most important key, involve your spouse or your partner in this. This is a team exercise. They're with you, you have to do this, and you have to do this together. So this is going to be data collection, it's not data analysis. You're not going to make distinct decisions as you're collecting the data. It's fact finding, not fault finding. And whatever you do, it's going to be tough. Keep your emotions in check, keep them out of the room. If we go to the next slide, Patrick, here's an example of the personal spreadsheet. On the left-hand side, you're seeing cash coming in. Right-hand side, basic expenses or cash out. That's a simple, we're going to get a cash flow for you. Look at the average of your monthly income that comes into your banking account over the last normal 6 months, say September through February. And then take a look at what the anticipated amount is over the next 6 months. That difference is going to be the change in income and the number you're going to have to try to address. On the expense side, calculate everything out as a monthly expense. If you're paying something every 6 months or every year, just divide it by the appropriate number, enter it into the spreadsheet. Mortgage, rent payments, whatever properties you have, whatever vehicles and leases you have, every loan you've signed for, whether it's yours, your education, your children's education, anything you need to keep everything operational. I put down utilities, internet, put all those expenses there. The total of all your insurance payments, and that's a key factor we're going to come back to in a little while. All your tax bills, what you're paying property tax, what you're paying taxes on your vehicles. And I put down all food expenses, kind of a surrogate for life. I mean, you have basic food, we may have entertainment, you have everything. Now take all your credit card payments and just even get a feel like December, January, February, when things were normal, average them out over 3 months and see what your outflow was. Most of us don't even do that. At least get that, and then we'll break those down a little bit later. Your club fees, your association fees, whatever you do, and then of course medical expenses. Some of us have fixed obligations or expenses. We're taking care of other family members, parents, children. It has to go on your expense side. You have to know what your cash flow is, monthly income in minus the monthly expenses, and you have to know how much disposable cash you have and what kind of liquid assets, which means cash assets that are available. Next spreadsheet, next slide. Now, this is your business spreadsheet, and this is a lot more complicated. And it may not be as easy to get everything there or everything really assessed properly, and you're going to have to get some accounting help in many cases. But you really need to know your total value of your cash on hand and what your convertible assets are and what you own and what the fair market value is. You also have to know how much you have in loans on your different items, how much the business is going to be responsible for, and how much you're personally on the hook for. Those are the negatives. Those are going to be minuses. And your total outstanding accounts receivable. When you put all these numbers together, that's going to be the rough estimate of how much your business net worth is. When you look at the liabilities, just being in private practice, I could tell you the liabilities are going to come down into a couple of huge chunks, about 3 of them. One is my physical office space, my rent, my mortgage, what I'm doing there. The second one is my personnel, my salaries for my staff, their retirement benefits, their employment taxes, workman's comp, unemployment, any other taxes I have to pay on them, the licensure. And then the other big thing is professional liability for myself and for every employee. And then we just take a look at all the other insurances. Then you come down and you break it down about what you're doing to keep the lights on, basically your utilities, your internet, your EMR. And as you can go down that list, you can pretty much see that. But that's going to be your average monthly expenses for the business. Now, if you take a look at your monthly income and take a look at the average income from, say, September to February, take a look at what you anticipate between March and, say, September, October. So you're going to have 2 different incomes you're going to be working with. The income minus the expenses is going to be your revenue balance, what you're going to have left or what you're going to need to make up. And it's very important to know what the total value of that cash on hand is, how long your business can survive with those negative values. So if we take a look on the next slide, what you're going to do is you're going to take these results. You're going to add the detail as you need it. Add rows, add columns, add other worksheets. Try to do this. Try to get the numbers as close as possible to be able to make some real decisions. And once you know, well, let's go to personal first. Once you know your personal financial status, that's when you, your spouse or partner, that's when you have to have some real discussions, because this is where you're going to have to start really making some choice and rationally prioritize some of these expenses. And again, you can't get emotional about this. This is your life. This is your personal and financial health. This is really important. I will tell you from my perspective, do not miss a life or disability insurance payment. You can get forgiveness on a lot of things. You can kick some things down the road, some of these loans, some of these mortgages, as you'll hear a little bit later on. But the life or disability insurance payments, once you're eligible, once you're insured and you miss them, it's hard to get it back. For your business, take a look at your business. Take a look at how your business is really doing here. Is it resilient? Is it going to really bounce back quickly? Is it viable? Will it recover to volumes and income in a pretty short time? Or is it really on life support? And I think you really have to get professional advice here. This is not for you to jump to a real hasty conclusion and really get emotional about this. What you need is your accountant and your attorney. So I'm just going to leave you with, just remember to take your time with putting this data together. Even if you're in okay shape, you may find you're fine. You're going to come out okay. That's great. You may find you have to make adjustments. But even if things haven't changed much for you, I find this to be a very valuable exercise to go through at least once a year, in order to be able to take a look at those things where you can make your tweaks and make your accommodations so you can have some really good planning going on. Keep focused, keep yourself in control, and just kind of keep going straight. Resilience is about moving on. So with that, Patrick, I'd like to turn it back to you and let you move on.
Thank you, Mark, for walking us through that integral, very important exercise for folks who are listening in this evening. The Economic Survival Strategies document breaks down circumstances that one may find themselves encountering into three broad categories. Scenario number one pertains to the employed surgeon, and we're going to have Dr. Mark Savarese discuss that with us. Mark?
Thanks, Patrick. Can you hear me okay?
Yes.
All right. Thanks. Welcome, everybody. Good evening. So I'm going to address the first and most straightforward of the scenarios, and that is basically the surgeon who gets laid off because of the slowdown associated with their healthcare system with the pandemic. There are some key points. There are some things that you have to do immediately that I cover on this first slide as you go forward. And all of these points essentially build on what Dr. Ader has already talked about your personal financial status and knowing where you stand. So one of the points that is very important, that's unique to the employed surgeon, is to first go back and take a look at your employment contract, specifically the pages that pertain to the terms of termination. Most of us, when we signed the contract, didn't pay a great deal of attention to this, even though we should have, because you're starting a new job. You really didn't want to be thinking about leaving that job, but it's probably the most important part of your contract. It will typically spell out in there terms such as non-compete clauses, need to provide tail insurance for your malpractice, and the term of the contract, that is how many days notice either side must give. There are two types of termination. at will, and for cause. For cause is generally due to some egregious behavior, such as losing your license or committing a felony. So in this case, you're generally talking about at will employment, which is what most of us have. And it usually specifies a 30-day, 90-day, 180-day term to termination, which is the most important point to make. But in there, you'll also need to look at what the terms are regarding your non-compete clause, if you have one, and your malpractice insurance, whether you have claims-based or occurrence-based malpractice, and whether or not you or your employer is responsible for your malpractice tail. A couple of other immediate things to do, and this may not be intuitive. You are eligible to receive unemployment benefits. Your employer has been paying into the state unemployment fund, and you should go apply for your unemployment benefits through your state. You should also take a look at COBRA, which is the ability to extend your employer-based health insurance at your expense, because probably your employer-based health insurance is better than what you're going to find for yourself for individual health insurance on the open market. And then the last point is important, is to make your best guess at the length of time before you're back to work. If this is a furlough, then you might already know that in 6 months you're getting rehired with the same group. If this is a termination, it's not the end of the world. You have a marketable, valuable skill that there is still a demand for. And so at some finite period, you're going to be employed again. And so when you do your exercise with your Excel spreadsheet, you need to make your assets and your other values work for that period of time. Pat, can you go to the next slide? So a couple of specific considerations when you're doing that budget exercise that Dr. Ader took you through. First of all, some of your insurance premiums, particularly health insurance, but also potentially disability, life, long-term care, and others, might have been paid by your employer, and now you need to put those into your budget. If you have to pay your malpractice tail, you have to put that into your budget, and that usually comes with a specification over what period of time and what number of payments that amount has to be made. Then, as you go forward with a finite budget over X number of months, some strategies that you can consider. Dr. Ader touched on some of this. First of all, don't just miss payments. You can always seek forbearance on payments, particularly if you have a personal relationship with your bank or lender. Your bank really doesn't want to own your home, your car, or your business. They want you to keep paying on it. And you may be able to get interest or even principal plus interest deferred for a period of time. Look at that for professional as well as personal expenses. Then look at all the things that you pay for monthly. Some of them that might be professional related, you might want to do without, and some of them that might be personally related, you might want to do without. And I think all of this can be done in consultation with your financial planner. So I'll reiterate 2 points from Dr. Ader. One is that this is an exercise for you and your partner. And 2 is involve your financial planner, accountant, attorney, or whatever other professionals that you need. Money spent up front doing that is well worth it in the end. And those are the points that I have for this, Patrick. I'll turn it back over to you.
Great, Mark. Thank you very much. Our next scenario deals with a private practice surgeon whose practice is underwater in expenses. This scenario will be discussed by Charlie Mabry. Charlie?
Thank you, Patrick. And welcome, everyone. I appreciate you all logging on and listening. As Pat said early, the handout is on the right side of the screen. You can download that. It's very important. And my thought was for my segment, not to really reread the handout, but to emphasize some things I think throughout both scenario 1, 2, and 3, and also Mark Ader's discussion of the balance sheet and the spreadsheet. All of that's very important. One of the things I think to think about is, regardless of whether you are in scenario 1, scenario 2, or 3, is early on, get professional help. And the reason for that is there are many times that it's a chess game. You have to think of steps that you need to do now, tomorrow, a month from now, 6 months from now, and having professional help will make you make the right steps and avoid doing something that may irreparably harm your financial status or your business status down the road. Now, scenario 2 really is wrapped around the concept of that you yourself are personally okay as far as finances, but your business, your practice is really underwater and you may have to declare bankruptcy. And so the other thing to remember is bankruptcy is only one of many, many options to consider. It's something to consider early on, but not necessarily make that your only choice. The spreadsheet that you've been provided is excellent. And it's divided into 2 parts, the personal and business. And so we're going to talk a little bit about the business side of the spreadsheet. The first thing to do is really collect the data and fill out the spreadsheet. This will help you get a better picture of where you are both personally as well as on your business side. And in addition, this will save you time down the road as you employ advisors. You want to minimize the time they take to get you organized. So the more time you spend to get yourself organized will not cost you anything, but actually help inform you, but also make their job easier. Pat, you want to go to the next slide? So the 3 groups or people I think you ought to really consider is first a CPA. Most physicians in practice, most surgeons that have their own practice have a good CPA or a CPA firm. Now, you're not the only one that's ever gone out of business. In fact, many people do go out of business. Think of the farmers and other small businessmen around the country. So for a CPA firm or CPA, they're used to this. They've had many clients that have either gone to the verge of bankruptcy or have gone through bankruptcy. And so get in contact with your CPA early on and learn from them what they think about your situation and get advice from them. And as pointed out, the last thing that your creditors want to do is to take your car, your house, your exam table, your colonoscope, whatever you got in your practice. They don't want that. They want you to keep on making payments. So your banker, or your local banker, is great for advice because once again, they've helped other people go through these bad situations. They can look at your loans that are outstanding, and there's several different options that they may offer. They may offer a loan consolidation process where you take multiple loans, put them together, and get a lower loan rate. You may ask for non-performance status on some of the loans that you owe them. Non-performance status means that you will delay payment on your interest and or principal for some time, and then at a later point resume payment. There are short-term business loans to keep your business afloat for a short time period, 90 days, 120 days, etc. So those are things the banker can help you with. They can supply capital. They can supply a loan of forbearance or forgiveness for a short time period, but also give you good advice about how to navigate the waters. And while it may be counterintuitive, if you are considering bankruptcy, one of the best persons to get on your side is a bankruptcy attorney early in the process. Don't wait till the end. Get them involved early. Their job is to keep you out of bankruptcy or get you out of bankruptcy once you're in it. So getting them involved on the front end will really help you get good advice about how to manage your different creditors, and they can negotiate on your behalf with different creditors far better than you can. They know what most creditors will want from you, and they can help negotiate probably better than you can how to renegotiate those loans or reduce your payments. I believe that's all I have for my slides. I think the most important thing, though, is going back to what Mark Ader and Mark Savary said. Pay attention to these spreadsheets. They're really good. They will help you in the future. You know, COVID is probably going to be a short-term problem we have. But at the same time, I think these planning spreadsheets will be extremely valuable for the next future that you have, the next 20, 30 years. They'll help you be successful in practice. So with that, I'll end my talk. Thank you.
Thanks, Charlie. We have had a question that's come across wanting to know where the Excel spreadsheets can be found. And in the handout section, there's the 4 documents, and the spreadsheets are on pages 4 and 5 of the Economic Survival Strategies document. There are links to them there. And all those documents should be downloadable for you at this time. Our third scenario is also pertinent to private practice, but deals more specifically with difficulty with one's personal cash flow and living expenses. And Julie Conyers will be discussing this scenario with us. Julie?
Thanks, Patrick, and thanks everybody for attending our webinar. So this is a scenario of a leveraged surgeon who probably was limping along and then suddenly got hit with COVID. And this surgeon really does need a plan. They need an immediate plan and a long-term plan. But the immediate plan is just like Dr. Ader and the others were talking about, is to understand what their cash flow is. And probably the assumption in this scenario is that they are not going to have the cash flow to meet their debt obligations. So they're going to have to come up with a short-term resolution to their debt crisis. Just like the other members of the panel have discussed, that it's probably better to approach your creditors before they approach you. And they do not want your assets, and see if they'll be willing to work with you. This surgeon may not have a financial team, or perhaps they need to assemble one or consult their financial team and help them prioritize their spending. And this would probably be the most stressful phase of this surgeon's plan, as they find out what sort of how far they are behind financially. Next slide. Their intermediate plan is probably going to be a change in lifestyle, but again, this is in the context of a first world. So if this was a surgeon that has been living from paycheck to paycheck and assuming debt, things will probably have to change, not just because COVID came along, but because they're not on a trajectory for saving and where they need to be. So there would probably need to be a disciplined spending to build cash reserves, and ideally accumulation of about 6 months of cash reserves, and then a plan for resolution of outstanding debt. And that's going to be, I think that's going to be a very difficult time for many people. The more debt you accumulate, the more difficult it is to get out of it and to save at the same time. This could be another time when the surgeon may need to consider their present and their future practice models and locations. And if they're considering a change, also looking at the cost of those changes. So if you're going to close your private practice and move somewhere or start in an employed position, there probably will be a cost for a tail coverage, which could range anywhere from even $40,000 to $60,000, depending on your state, the costs of moving. But again, if you're considering another job, some of these things are actually negotiable. So this is kind of a plan to re-equilibrate for the surgeon and think about their future plans and their future practice model, also taking into consideration the needs of their family and their spouse. Next slide, Pat. So that brings us more to the long-term plan, which in this scenario, the surgeon probably hasn't been thinking to, or could think more about. And one thing is, what is the future of our predicted income? And if we're looking at the Medicare cuts that we're expecting in the future, we probably should expect our incomes to decrease over time. Also, what are retirement goals? And those could be based on your health. It could be based on your longevity. Many things can go into your retirement goals. Each family will look into their educational goals for their children, for their spouse, and other family goals that others have mentioned. Do you have aging parents that you have to take care of? Do you have to have good health insurance for a sick family member? You may have a goal for some acquisitions of property. And those can be various forms in stocks with dividends, or if you can pay cash for properties with passive income from rentals. And then most importantly are your debt payoffs. So as you age in your practice, your debt to equity ratio should be decreasing. In other words, you should be building more equity in your portfolio, and then your debt should be decreased to virtually nothing. So when you retire, you may have the option of debt like a mortgage if you choose, but you may also have the option of not having debt. And then eventually we have to plot our trajectory of finances for eventual retirement. So it actually, it lands somewhere that's realistic. And, you know, we have chosen professions where there's been great opportunity cost, where it's taken 10 years to educate ourselves to be able to realize an earning potential. And then, and we have to make up for that. So, we've compressed our earning years in a much smaller amount of time. So that's all. Thank you.
Great. Thank you very much, Julie. We've intentionally reserved some time for questions tonight, and there are some that have been submitted ahead of time, and we'll start with those. But I would encourage you to use the question section to submit your questions, and we will we'll work through them sequentially here. So the first question I'm going to pose back to Mark Ader, and that is, Mark, one person has asked, are there any financial strategies or specific actions that you would never consider implementing?
So I think Dr. Mabry put it very well when he says that, you know, we're facing COVID now, and COVID's going to come and go. And we're going to get through this. And as Dr. Sarabee said, you know, you've got your MD, you've got your board certification, you got your FACS, you're going to have a job. And I think it's important to remember not to blow up a lot of what you've been saving for and working for over what may be a short-term, and we're hoping it's a short-term issue where we can get through this, and what we need to do is just kind of get to the, you know, just to the other shore. So I would not touch retirement accounts. You know, and I was a little bit disturbed to see some of the you know, medical throwaways saying, well, you could always tap into your retirement account or your IRA or borrow from that. That's not the thing. I don't think I would do. That is really pulling, you know, pulling a solution of really last resort. It's going to take you years to catch up if you pull that money out. So pulling money from your retirement accounts, especially to save a business that's going to fail, is not a good idea, or even to get around, you know, your personal finances. There are other ways. The other thing I would not do is miss a life insurance payment, miss a disability insurance payment. You're insurable now. You have been insurable. You have the policy. You give those up, you're not going to get those back. If you're paying for insurance tail and it's on a monthly basis, make those payments, because if something happens, you want to be covered. It's all about protection, and it's all about planning. You just got to remember that this may be a short-term really stress, that you're going to come out okay on the other side.
Great, thanks, Mark. Our next question is from
Pat, this is Mabry. Let me add one thing that
Yeah.
I think Mark brought a very good point up. Just real quick, if you go into bankruptcy, your retirement accounts are typically protected. Once you pull that money out and start putting it in your bank account, it's no longer protected from bankruptcy. And so his point is extremely important. That should be the very last thing you ever pull out is your retirement accounts.
Great, thanks, Charlie. Our next question is from a surgeon who was employed and has been terminated and just started looking at his contract. And that contract says that he can be dismissed for cause or at will with notice, and that he's prohibited from practicing within a 25-mile radius of the hospital for 2 years if he was to be dismissed. The question is, does this clause apply if I'm dismissed for no reason other than the pandemic, or can I ignore that prohibition? I'm going to ask Mark Savarese and Bill Chaffee both to respond to that. Mark?
On one of our past webinars, we did have a contract attorney address us, and she was pretty clear and pretty discouraging about this point. And that is that all of the provisions of your contract are absolutely enforceable unless there's something in there that explains why it's not enforceable in some circumstance. So if your contract has a non-compete clause, it's in the contract, you signed it, and you are held to that if the employer follows the rules of the contract and gives you proper notice. Same is true for a malpractice tale. The duration of the no-compete clause is still valid. There may be a possibility to negotiate it with your employer, but I'd even say that this is something that, you know, if you pay a contract attorney to review your contract and it's that clear in your contract, you probably wasted the money paying the contract attorney on that.
Pat, this is Bill. I'll add just one more thing to that, however, and that non-compete clauses are extremely variable state to state. So in the state that I live in, Rhode Island, for my graduates who want to stay here in Mass or Connecticut, and they put non-compete clauses in. If it's in Rhode Island, although other employers try to do that, they're actually not enforceable in my state. And so I do think the one thing that I would add to what Mark said is that you need to understand how that relates and to where you're employed. I have a surgeon daughter who just signed a new contract. She just moved. And she was able to negotiate the non-compete clause. It's in a state where they do enforce it, but it was really key about what's the circle of non-compete. And so in her contract, it's a 10-mile radius of her primary office. She's moving to Atlanta. There's lots of places she could work in Atlanta outside of the 10-mile radius of her primary office. So the only thing I would add is it may be worth the legal advice. Because again, there's a large number of states where non-competes are really hard to defend from the employer side, number one. And number two, your employer's terminating you because of a COVID crisis. They're doing it not for cause, and so they're going to say it's for that reason. And I suspect you would get a favorable ruling on that in many states.
Thanks, Bill. Thanks, Mark. So our next question is from someone who's taken some of the steps that we have outlined with the Excel spreadsheet because they've done their budget and determined that they will not have enough money to pay my bills for the next 6 months, which is when they anticipate starting a new job. Where should he or she look for money to borrow to make ends meet in the interim? Tyler Hughes?
Thanks, Patrick. You know, when you look at that scenario that you just gave me, you think, well, that's pretty bleak. You know, you got 6 whole months to go. How are you going to get through? And I think one thing you have to remember is that you have earning potential, and that's something that has been being stated, if not obviously implicitly, because as my mentor said, there is always a market for a good surgeon. And therefore, lenders are going to look at you in terms of your earning potential, not necessarily just what your current situation is. Bankers and lenders make money by people paying interest, not necessarily by paying off loans rapidly. Therefore, the first maneuver, once you know that number that you're going to have to hit, is to consider that can you consolidate your loans and extend the loan duration and lower the payment because you've lengthened the duration of the loan so that you can then make your endpoint. If you haven't taken out a second mortgage on your home and you're not upside down in that mortgage, that's a reliable loan that lenders like to make because they figure you're not going to give up your home. You'll pay off your debt first. And since you have a sellable asset, that's a well collateralized loan. Walking into a bank and asking for a personal loan for $50,000 or $100,000 is what we call a negative loaning experience. Bankers do not like making loans just because you're a good guy or a good surgeon. So try to avoid the personal loan approach because that's the weakest. And then finally, you may have had in your spreadsheet, you see that you've had a savings account or something, and that has between $50,000 and $500,000, depending on how diligent you've been. You don't have to burn through all that cash. Many investment funds or banks that hold those monies will have a guaranteed loan amount at really fairly favorable interest rates, where they will make a loan for you against the cash that you have saved. That way you're not burning your cash that you've saved, and it's the delta and the difference between the interest you can make and the interest you have to pay on the loan. But those are some of the things that will give you up to 6 months of living expenses as you go along. And then also remember, one of the great things about being a surgeon is that you have potential. And even if your practice right now is at zero, making money for you, you can take a locums job, work in an emergency department. A lot of what goes on when people get in financial trouble is be willing to accept the reality. You may really want to operate every day in the OR, but that may not be open to you right now. Use your medical license and your medical knowledge to generate income for you, and that will reduce your cash shortfall that you're experiencing. And the good thing is, in 6 months, you have a job. That employer might even give you a signing bonus when you're negotiating because you're a good surgeon. They want you. They'll say, we'll help you out of that 6 month crunch. So those are some of the ideas I would use. Thanks.
Great, Tyler. Matt, you have a question for us?
Sure, we've received a few questions now. The first one is, should we still keep paying into our 401k?
Mark Ader?
Yeah, I think if you can budget it, I think you should. I think if you have to skip a month or two, that would be fine. But certainly, if you can still continue to fund your 401k, your 403b, whatever you're going to have, just go ahead and do it. If you pay yourself first and you put that money away, you can have a more realistic view of the rest of your budget.
And this is Tyler. I'd like to piggyback on that, in that if you're fortunate enough that you can also create a savings plan, not just a retirement plan during the difficulties, remember that every dollar that you save or invest today is worth 2, 4, 16 times in 10 or 20 years. So that's one of the long-term strategies of getting out of debt is, develop that reserve, develop those savings, because the eighth wonder of the world is compound interest.
Great. So we got a question here from a surgeon who received a Medicare advance payment, and he does not believe that the practice is going to be back to normal in time stipulated in the terms for the payback, especially if we do encounter an anticipated second surge of the virus. And so the question is, what is the possibility that the terms for repayment will change? And I think that we should have some better indication of that in the coming weeks as Congress is currently deliberating what will be in the next COVID relief package. Specifically, the college and the other surgical groups in DC have been advocating for an extension of the period of time before the clawback of those funds from your claims submitted begins, to reduce the percentage of those claims that they do claw back. Currently, that's 100% of everything that you send in, they withhold as a payback. And then to also reduce the interest rate on that once you get to the point in time where you have to start paying interest on it if you've not repaid it. Those are some pretty steep interest rates right now. And with the federal funds rate currently being as low as it is, advocating that Congress adjust that so that people will have a lower interest rate to pay, more time to pay the loan back, and that they will claw back less percentage of your ongoing claims going forward, so that you'll have some capital with the procedures, et cetera, that you're submitting claims for. Matt, you got another question for us?
Dr. Bailey, I actually have a related question. We had an attendee ask about the Paycheck Protection Program and whether or not that loan is likely to be changed, or if people will still only have 8 weeks to use those funds. And there's actually a very timely update. There's been some positive momentum with that legislation. It passed in the House last week, and just earlier this evening passed in the Senate unanimously. So if all goes according to plan, that will be signed into law. It'll allow additional time for the use of those paycheck protection payment funds so that they can be forgiven, and some gentle easing up on the rules of what the money can be used for as well.
Yeah, that's great news that they have extended that 8-week period out to I believe it was either 24 weeks or December the 31st, whichever came first. So I think that's great news for that. Any other questions, Matt?
Yeah, we had an attendee ask if they had been turned down for one of the economic injury disaster loans based on their first electronic submission, if there's any way that they can apply anew or have that application reviewed.
I believe that as it currently stands with the EIDLs, every business interest except for agribusiness has been foreclosed from receiving an economic injury disaster loan. So that is no longer available currently for any business other than agricultural business. As far as we know, there's been no indication otherwise. The Paycheck Protection Program is still available. That program has now had somewhere around $670 billion put into it. It did run out of funds the first time, but was replenished. And as far as I know, that program is still available. That program, you specifically apply through your local SBA lender, which will be your local bank. And that is the program that has loan forgiveness provisions associated with it. And that's been very, very popular, as we talked about, for folks. Matt, any other questions?
Yes, we just got an interesting question from an attendee who's interested in doing locums, but under their contract, they must notify their group if they intend to do so. And they have been told by their group that they would prefer that they do not do this. Is there anything that this individual can do?
Tyler?
Well, I think like all things personal and business, you have to talk directly to the deciders who don't wish you to do that, and see if your contract says that you have to get permission, and that's in writing, you're probably going to have to obey that. portion of the contract or risk free to the contract, which would end it. The question is, is this contract really worth that to you? Are they going to be taking you back, and that you need to search for other reasons for it? But I'd find out the why of why they would rather you not do this, and then see if you can work on that answer to make a good decision both for you and for them, especially if you plan to have long-term employment with them.
Mike Sarah, do you have any thoughts in addition on that, what he might be able to do?
Yeah, I guess it depends on the size of the group, and maybe the reason they don't want you to do malpractice or locums is that they would be an additional malpractice risk to the group. If they have a group policy, they're all liable if one person does. That's the only thinking that I have in terms of why they would not give permission for that.
Great. Matt, another question?
I have an individual who pointed out that certain life insurance policies will allow you to take a loan against the policy. And I was wondering if any of the panelists had thoughts on that as an option for capital.
Yeah, most whole life policies have a loan component to them. You loan against, you borrow against the actual insurance value of the policy. Before I would exercise it, I'd look at all of the ins and outs of it, especially the interest rates. You may find that especially now with the interest rate, the prime rate being so low, you may be able to get a better interest rate from another source. And even then, you might be able to put up that same policy as collateral if whole life policies also have equity development in them. So there's a possibility you could collateralize a different loan against that policy. I'd say the main thing is look at the interest rate. The insurance companies are good at winning when it comes to exercising those whole life benefits.
Just another thing too, Tyler, is Mark, if I could just piggyback on, is that many of these policies, you've locked in many cases, an interest rate that may be a lot better that you may be able to get if you're going to repay that money back. It's accruing value in there, which is offsetting the cost of your premium. So it could be, and then you're going to pay interest on it on top of that. So it could be a multi-whammy, if you will, against using that particular source of income. Now, in some of these whole life policies, they have a provision that you cannot borrow against them at all, simply for that reason that they feel that they will be underfunded in the end. So I would be real careful. I think your idea of using that life insurance policy as collateral for an external loan against it is much wiser, especially given the interest rates and the potential for penalties.
Thanks, Mark. Anybody else have any other thoughts on that? Okay, another question that came in also related to the Paycheck Protection Program is that a surgeon submitted an application but was not approved and wonders if there are any suggestions to increase the chances of success through reapplication. And I guess my first question would be, were you not approved because your application went through or was processed during the period of time, albeit brief period of time, when the funds had been totally exhausted and before they were replenished? And if I could determine that that was the case, then I would just go back to my original place that I applied and resubmit the application. What we have heard is that most of those that were submitted, even if they ran up against the period of time when the funds ran out, they just went ahead and rolled on through after the funds were replenished. The other suggestion that I would potentially have is to go and submit an application through another SBA approved lender, another bank in town, or another credit union in town.
Yeah, Patrick, this is
Pat,
Bill.
yeah.
I would reiterate that for my group, I had to go to 3 banks before they got a clean the same application, but 2 of the larger banks, I won't mention them, did not have a good process. The 3rd bank managed to do it in about 4 hours, submitted at 8:30 one morning and approved 12:30 that same day. So sometimes it's the lender that didn't have a good process, and they don't want to tell you it's their problem. They'd rather tell you it was your problem.
Great. Thanks for that, Bill. Matt, do you have another question for us?
At the moment, the only other one I have is one that I believe you touched on to a degree earlier, but it is, do you think further funding support will be available to physicians similar to the PPP or the HHS provider relief grants if the COVID-19 slowdown continues?
So we'll break these things down into grants, loans, and advances. And the grants came out of the CARES Act and the Public Health and Social Services Emergency Fund, and there's been 2 disbursements from that thus far. They've been pretty well targeted, at least initially, based on your 2019 Medicare receipts, and then once you filled out the necessary paperwork attesting to the terms and conditions, then the potential existed for a second disbursement to you, with the idea that they were going to try to drive that to be about 2% of your total receipts from all payers in 2018. I'll pause here and say that I'm going to put a lot of stuff out there pretty quickly, but all of this information is in the financial resources document that's tabbed in the handout section. A lot of the questions about the grants have come from folks who maybe they didn't have a whole lot of Medicare income. Medicaid was more of a driver in their practice, and when were they going to get funds? And earlier this afternoon, received notice that the Senate Finance Committee and the House Energy and Commerce Committee have sent a letter to Secretary Azar in Health and Human Services requesting that he respond by June the 10th as to when those types of providers, those providers who depend more on Medicaid, will receive some funds. So that's the grants. With regards to the Medicare advance payments, they dispersed $100 billion out of that pretty quickly, and it was abruptly ended on a Sunday morning. And we have heard no indication that the Medicare advance payments program will be coming back. As I mentioned earlier, we do hope that there will be some adjustments into the terms by which those advance payments are repaid, and that's a source of ongoing and aggressive advocacy efforts by the DC staff lobbyists. The loan programs are the EIDLs, as I mentioned earlier. Those have been foreclosed except for agribusiness, and then the Paycheck Protection Program, which we have discussed here, as far as we know, is still available. And as Dr. Chaffee just pointed out, if you've been turned down for that one time before, you might go and consider another bank to make application. So we're approaching the top of the hour here, and I wanted to give the Practice Protection Committee opportunity to, if any of them had any additional thoughts, final words that they wanted to provide before we wrap it up. So, guys.
Yeah, Patrick, I have 3 very brief things. First, if you're in a situation where you're in cash flow trouble, whatever you do, do not go silent. You must talk to your creditors. You do not want them calling you. When I was a bank director, that was our saddest thing, is that suddenly the checks quit coming, and then they wouldn't answer the phone calls. I know it's an ego hit, but you can't go silent. They really do want you to succeed, because if you succeed, they succeed. Second is, These are incredibly stressful events. Please seek counseling so that you can help keep your mental equipoise. And finally, just today, the ACS released a toolkit on how to reassure patients about the safety of coming back for needed surgery. And that's going to be one thing that's going to help your practice pull out of the nosedive, is to get those patients back into a safe surgical environment. Thank you for that, Patrick.
Very helpful, Tyler, and very timely and poignant. Anybody else? Well, I want to thank you all for attending tonight. We hope that you have found this information helpful. Again, we are posting regular updates to the financial resources document that is coming out in the newsletter on Tuesday. The links to the economic survival strategies document was provided in the newsletter that came out yesterday. And if you have any questions, you can feel free to reach out through the college, through the Division of Advocacy and Health Policy, and we would be happy to try to provide for you the resources that we have to help all of you get through this very difficult time. Wish you good health and a good evening. Thank you very much.